Thank you, sir. So I would like to call Dr. Triveni Chimata. So basically, she is going to talk about demography and clinical analysis of traumatic optic neuropathy.
Good morning, one and all. I am Dr. Triveni from NRI Medical College. Here I am going to talk on study about demographic and clinical analysis in cases of indirect traumatic optic neuropathy. Our aim is to analyze the demographic data, time of presentation, and the role of steroids in visual recovery of patients with indirect traumatic optic neuropathy. Under inclusion criteria, all the cases of indirect traumatic optic neuropathy treated between July 2021 to June 2023 at NRIGH were taken. Head injury patients with sudden loss of vision showing RAPD, normal fundus, and normal neuroimaging were taken into the study inclusion criteria. Under exclusion criteria, patients with open globe injuries, patients with traumatic parenchymal injuries, history of underlying neurological disorders, patients with other ocular diseases, optic nerve avulsion, cases of trauma presenting with signs explaining the loss or diminution of vision were excluded from the study. Coming to the materials and methods, it is a prospective study which was conducted at NRA Medical College and General Hospital. Duration of study is 2 years between July 2021 to June 2023. All the trauma cases attending the emergency department or cases attending the OPD was taken. We have no financial interest in conducting the study. Regarding the procedure, all the patients were clearly explained about the study procedure and informed consent was taken. A total 18, based on the inclusion and exclusion criteria, total 18 patients were taken into the study. Relevant ocular history was taken. History regarding the mode of injury, time of injury, and time of presentation was taken. History regarding wearing protective devices like seat belt and helmet was taken. Visual acuity was regarded as Snellen's chart wherever possible. Anti-segment examination was done. Complete pupillary examination was done and color vision tested in patients with better visual acuity. Visual fields were done in patients with better visual acuity. Fundus examination done bedside by direct ophthalmoscopy or slit lamp examination by biomicroscopy by 90D lens. Among total 18 patients, all were treated with steroids and follow-up was done at 3 days, 2 weeks and 3 months interval. Analysis is based on age, gender, laterality, mode of injury, either RTA, fall, assault or other miscellaneous causes, presenting visual acuity, anti-segment findings, fundus examination, radiological findings. All the patients were given IV methylprednisolone 1 gram per day for 3 days, followed by oral steroids 1 milligram per kg body weight, which is tapered over 2 to 3 weeks period. And visual acuity was regarded as static, improved or deteriorated. These are the pictures showing the results among the gender. Males, out of 18 patients, 16 were males, showing 89% male preponderance. And age group also more than 30 years of patients, 16 patients were there, showing 89%. Coming to the laterality, 69% of the cases are showing right eye involvement. And regarding the mode of injury, 17 out of 18 cases are due to RTA and only 1 case is due to assault. And time of presentation, 12 cases presented immediately after trauma, 6 cases presented after 48 hours. And nobody has taken any safety precautions among these 18 patients. Coming to the anti-segment findings, 2 only showing subconjunctival hemorrhage and RAPD is observed in all the cases. Presenting visual acuity, there are we have divided into 3 groups. One is 6/24 to 6/22 patients were there in this group and 6/62 perception of light. 10 patients were there and among 6 patients there is no perception of light is observed. And visual acuity after steroids in 2 patients in the group 6/24 to 6/60, 2 of them have shown improvement and with 6 out of 10 patients in 6/62 perception of light, they have shown improvement, that is 60%. And among 6%, 6 cases of no perception of light patients, only 2 has shown improvement, that is 33%. And 12 cases that are presented immediately after trauma, among these 8 have shown improvement, that is 80% of the cases that has presented immediately after trauma have shown improvement and 2 out of 6 cases that have presented after 48 hours have shown improvement. And visual outcome is static in 8 cases, improved in 10 cases and in no case it is deteriorated. This is a master chart showing visual acuity improvement. There is improvement of 2 to 3 lines of Snellen's chart in these patients and among no perception of light patients, visual acuity improved up to CF 3 meters. Coming to the discussion, indirect traumatic optic neuropathy is due to a closed head trauma that results in transmission of shearing force from forehead to the optic nerve in the optic canal or in the intracranial portion. It causes severe visual morbidity in the form of visual loss, RAPD, color vision defects, and visual field defects. In our study, clinical diagnosis is made by pupillary examination, anterior segment examination, and fundus examination. The average age of the patient is more than 30 years, that is 89%. Gender ratio is male to female is 8:1, that is showing male preponderance. The high male preponderance here was due to the fact that RTA is the major cause here, and which is the commonest cause of optic nerve injury, which occur more in males. Initial visual acuity ranges from 6/24 to no perception of light. All the patients have shown RAPD, and 67% of the patients had right eye involvement, which was also statistically significant. According to National Acute Spinal Cord Injury Study, early treatment with steroids within 3 to 8 hours of injury and continuing 48 hours were associated with better visual outcomes, which is similar to our study. And in our study, 56% of the patients had vision improvement after steroid therapy, which is similar results are found in other studies like Karmi and et al. The conclusion is there is definitely beneficial improvement in visual acuity with early presentation and with steroid treatment in cases of indirect traumatic optic neuropathy. Thank you once again for giving me this great opportunity for sharing the dais with the great personalities in neuro-ophthalmology. Thank you, one and all.
Thank you, Dr. Triveni. That was excellent talk. I think drawn is something which is very common. All of us do come across, and the observations that you highlighted that none of them were taking safety precautions is quite common. As regards the management, if the patients present early, majority of the physicians, treating doctors would definitely give a trial of giving systemic steroids unless until it is contraindicated. So one major contraindication we have to keep in mind that when there is severe head injury, because over there the long-term morbidity and mortality might be more, and in consultation with neurosurgery, if it is safe, it can be given. Otherwise, very high dose steroids are not indicated. And as regards our own experience, two observations I would like to add here is that not everyone improves. What is I really don't have a definite answer that this is the predicting factor that this patient will improve, but possibly patients who have very poor vision at presentation are the ones who don't improve. And you might observe significant damage in the fellow eye also, like field defects, VEP abnormalities are quite common if we look at this. But we have to help and try to help these patients. This is my